Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening. Mike Farrell here with you, and we want to let you know what the theme is on tonight's show. If memory loss is something you're suffering from, is it age or a disease-related problem? The latest research says what you can do about it. Reverse it with evidence-informed treatments. Dr. Gear, you surprised me. I mean, I know you and Dr. Wyrick are naturopathic physicians, and you're a chiropractor, but I didn't know you had anything to do with the brain.
Oh my. The brain is a tissue of the body. Mm-hmm. It works like all the other tissues. It has to be fed, and all of its cells have to work appropriately in order for it to function correctly. You have to feed it, you have to get the blood there, you have to get the right content of the blood. It's really, as one of my professors back in medical school said, he said, the human body is intricately simple and simply intricate.
Huh. Yeah.
And that's the way it is. It's like a million-piece jigsaw puzzle. First you have to get it outlined, and then you have to have that picture in your mind that you're going to work toward, and you start putting the pieces together. And the more pieces you get together, the better the picture starts to look. Well, I'll tell you, after my 57 going on 58 years of practice career, I've got a lot of that picture already put together in my mind. Dr. Wyrick, with all of his education in chemistry, is really right on it when it comes to the details of what goes on inside the cells. And I work pretty hard at getting the blood flow to the cells, and we both work at getting the right food into the bloodstream. So suppose Smokey the Bear was to lose it and started setting forest fires instead of putting them out. That roughly describes the behavior of certain cells of our immune system that become increasingly irascible as we grow older. Instead of stamping out embers, they stoke the flames of chronic inflammation.
Dr. Gear, you did it again. You used another big word. What does irascible mean?
You caught me, didn't you?
That's my job.
The key to the meaning of irascible isn't the negative prefix ir, which is used before words that begin with R, but the Latin noun ira, meaning anger. From ira, which is also the root of irate and ire, came the Latin verb irasci, to become angry, which led to the French word irascible.
Irascible.
So we had to take 2 years of Latin before we could get into medical school, back when I was going through my schooling. So we had a little bit of that Latin background. So you said it's pronounced irascible? Irascibly? Irascible. Well, anyway, it's irascible in English.
So are you saying that our immune system cells become angry as we get older?
Yeah, and that's exactly right. That's the focus of our show today. The idea for the show grew out of a newsletter I received from Brain Health Breakthroughs News, published by Lee Euler, in which he reviewed a research performed at Stanford University and reported it as Stanford Scientists Reverse Memory Loss in Mice. And the references came from the Nature magazine, January 2021, and Stanford Education, January 2021, and Science Alert, January 2021 as well.
And I will be putting up links on my website to those articles. It doesn't make for good radio to read the exact link.
Yeah, actually the research was reported, and then in Nature, and then the Stanford Educational News followed it and the Science Alert followed it, and all three of them were on the same subject, which is what we're going to go through now. So Stanford neuroscientist Katrin Andreasen, a professor of neurology at Stanford University, and her team of 22 neuroscientists published their findings in the journal Nature in January, now get this, of this year. So it's brand new information. Low-level inflammation that glows brighter with each passing year has become a hot topic in scientific research, often triggering a process known as, get this, Dr. Wyrick, inflammaging. Chronic inflammation is known to contribute to the development of cognitive decline and Alzheimer's disease.
So this is why Dr. Gear and I stress the importance of the IgG food testing at Payson Health and Wellness Center.
Absolutely correct.
And Dr. Andreasen also believes their findings have implications for most age-associated inflammatory diseases, which are basically the diseases of chronic diseases of aging.
Such as atherosclerosis and metabolic syndrome, frailty, arthritis, Alzheimer's disease. She added, saying she is very excited about the discovery's potential. However, it could be many years before a treatment, she means a researched drug, becomes available for people. In the meantime, Dr. Andreasen's findings emphasize the importance of eating a diet containing plenty of inflammation-lowering compounds that are found particularly in colorful fruits and vegetables. Some of these have been shown to block PGE2 at the cellular level.
Now, what is PGE2, you may ask? We'll talk a lot more about that later in the show, but basically it's a hormone that mediates inflammation in the body.
Exactly. So our S3 test reveals each of our patients' retained level of the carotenoid molecule in the fatty tissue of their hand. We just took 2 people today, free evaluation, and they were very healthy-looking middle-aged ladies, and they were very low in their S3 testing. Surprised them, but my goodness, it means that their system is not putting the carotenoid, which is the precursor of vitamin A, which is necessary for our immune system to function in a normal manner, into the cells like where they belong.
Okay, so carotenoids is a precursor of vitamin A, which is necessary for our immune system to function in a normal manner. Carotenoids are found in orange and green leafy vegetables. There are other compounds also found in brightly colored fruits and vegetables that are very important, antioxidants, and these include a group called polyphenols, which includes resveratrol from grapes, red wine, blueberries, cranberries, my favorite, dark chocolate. Then there's quercetin, found in apples, raspberries, onions, red grapes, cherries, and citrus fruits, and ficitin, which is found in strawberries.
Isn't quercetin also found in green leafy vegetables, Dr. Wyrick?
It is. The best source is actually onion skin.
Which part of the onion is the skin? I thought the whole onion was the same.
No, the outer dry, flaky.
Oh, you mean that thing that we all rub off the onion and throw it away?
Yeah.
And that's got something in it that we need to have?
That is the richest source of quercetin.
How in the world can I possibly eat that?
Well, if you grind it up, you can blend it into anything.
I see. Make it into a powder.
Yep.
Oh, my.
So, in addition to the carotenoids, there are other important antioxidants found in foods, and the short list includes vitamin C and selenium. And then there's beets, or if you are Russian, borscht, which contains betaine, which, when combined with certain B vitamins, helps control the inflammatory compound called homocysteine.
What in the world is homocysteine, and why is that bad?
Well, high levels of homocysteine are a better predictor of cardiovascular disease than cholesterol. That's significant. Also, high levels of homocysteine are associated with accelerated brain aging due to inflammation. In my opinion, everyone should be tested to determine their homocysteine level.
Dr. Wyrick, that's an awful big word. What is homocysteine?
Well, it's a product of normal metabolism in the body. It's something the body normally makes, but we don't want too much of it. Normally, the body uses something called methyl groups that are found in the beets or the betaine or other sources to neutralize the excess homocysteine. And vitamins folic acid, vitamin B6, and B12 are also needed for that process to neutralize the excess homocysteine.
This is starting to sound like a class in medical school. You know, it's getting pretty deep for me.
Well, the short message is beets and folic acid, vitamin B6, and B12 are good for you.
Yeah, they are. Everybody needs to eat these kinds of foods, raw and or blanched or steamed vegetables. So, how is this homocysteine test done? And what do you do if the level's too high?
Well, the test could be done using blood, which is the standard test available at SnorQuest, or using urine. Ideally, the blood test should have a result of 7 or less. If the homocysteine is too high, then the next step is to figure out why, whether it's because there's a nutritional deficiency or a genetic problem. If there's a genetic problem, then we may be able to work around the problem using epigenetics or special forms of vitamins.
So most allopathic doctors, that's MDs, do not test homocysteine. If it's so important to health, why don't they do the test?
Well, perhaps it's because there's no pharmaceutical drug to treat elevated homocysteine. So their mindset is there is no point in doing a test that they don't have a treatment for.
Now, when you say treatment, what do you mean by treatment?
Well, obviously, the treatment is do something that's going to lower the homocysteine level into the safe range.
So, Dr. Wyrick, you have a PhD in chemistry, and as a naturopathic physician, you have a good understanding of how to treat biochemical imbalances in the body, like elevated homocysteine. Is that right?
Oh, yes. I already alluded to them. Certain vegetables and vitamins are great for lowering homocysteine levels, and supplements can be used. And so that's what naturopaths do.
Well, let's get back to the research papers. In other words, we want to eat a diet rich in colorful fruits and vegetables to fight inflammation, while avoiding inflammatory foods such as refined sugar or anything processed or fried. These are also a wide variety of supplements available to help lower inflammation. You know, Dr. Andreasen, the lead researcher, neurobiologist, physician and researcher, has found exactly that. And when I talked to the lead neurosurgeon over at Barrows Neurological 20 years ago and asked them, what drugs do you have in the pipeline coming out? He looked at me and whispered at me, B vitamins. Mm-hmm. So, Dr. Wyrick, B vitamins are great, and they're a nutritional supplement. However, it's better not to have the inflammation in the first place. So our IgG testing is most important to identify foods that would otherwise not be known that are causing inflammation without anyone's knowledge. Just because there's no pain or discomfort when you eat a food does not mean it's without the negative effect on the immune system cells. That has a negative effect in brain functional decline and all the other degenerative diseases. The top examples stated at Stanford by the Stanford Research Group of 22 scientists led by Dr. Andreasen was atherosclerosis. What is atherosclerosis? It is hardening of the arteries. It's getting gunk in the arteries and shutting down the size of the artery by it's like putting calcium in your water pipe. Remember the old days when we had these steel water pipes, and we get calcium in them, and they start narrowing down the hole and shutting down the water flow. Boy, that was no good.
And the older the house, the slower the water.
Especially when you're in an alkaline area like the Phoenix area. So metabolic syndrome is another condition. What is metabolic syndrome, Dr. Weyrich?
Well, it's a combination of several malfunctions associated with diabetes or prediabetes and high cholesterol and high blood pressure.
Now, another one that they mentioned is frailty. Everybody thinks they know what frailty is. What is frailty, Dr. Weyrich?
Well, that's a rather general term for somebody who's just physically debilitated. Generally speaking, think of somebody that is very old and weak.
Well, why don't we look at it this way? Someone who's shrunk and their body has become less than it used to be. They become frail. They don't have the strength. They don't have the balance. They don't have
the muscle.
All kinds of detailed things. They don't have that specific ability to do fine things with their hands. That's frailty. And you don't want to get there, because once you get there, you can't reverse that. But we can make it less of a problem. So we want to get you before you get to that point. Generalized arthritis is a problem also that happens with this problem of eating the foods that are inflammatory to you. And then the last one here that they mention is Alzheimer's disease. That's the brain that we're talking about now. If the brain starts to deteriorate, just like the joints are deteriorating in arthritis, or the person's getting shrunk down, or they have this pre-diabetes, or they have diabetes, or they have all this calcification in the arteries, that's not good. So the Stanford scientists theorized that if you could stamp out these inflammatory embers, then you could save your memory. Now, using mice, they have succeeded in restoring lost memory. Did you get that? They have succeeded in restoring lost memory, and they're hoping that their breakthrough will lead to a revolutionary new memory-saving drug treatment. I can tell you right now, you stop eating the foods that make the IgG metabolic problem, where you get that 1 to 4 reaction with the food. You stop eating those foods. You get your spine straightened out so that you get good blood flow to the spinal cord and the brain. You do a little bit of exercise on a regular basis to keep the blood flowing. Wow, what a difference it makes. So the drug that they would come up with would be for those people who just won't properly take care of their body by fully correcting injuries to their spine, eating the proper foods for their individual body, and not consciously or unconsciously perseverating. That means going over and over a thought without any action. That causes stress, emotional stress. Any one or two or all three will cause stress in the body that speeds up the aging process of the mind and the body.
Well, great information. Let's get back to the research papers that we were discussing. Scientists have long known that cognitive decline as we get older, and specifically age-related diseases, including Alzheimer's, are linked to inflammation. But they're still uncovering precisely why and how this is the case. So, the research published in January of 2021 in Nature pinpoints the role of a messenger hormone that is found in higher levels in older people and older mice than their younger counterparts. And that is what we've been talking about, prostaglandin E2. When the hormone was blocked in older mice, they were able to perform as well as more youthful rodents in tests of their memory and navigation. Now, I'm not sure that the mice recovered prior memories, but they were able to form new memories, as in learning to run new mazes.
According to the research that the group did, they actually did go back and recover their old memories.
Ah, that's even better. The researchers found that higher levels of the hormone affected the metabolism of immune cells that are called macrophages, causing them to store energy rather than consume it.
That's right up your alley, Dr. Weirich. That's all that chemistry stuff you talk about.
Oh, yeah, it is. That ends up effectively starving the cells and sending them into a damaging inflammatory hyperdrive. They are irascible.
You like that word, huh?
It's a great word. That contributes to age-related cognitive decline and several age-related diseases. So, the hormone, which we've been talking about, prostaglandin E2, or PGE2 for short, is a major regulator of all types of inflammation, both good and bad, and its effect depends on the receptor that is being activated, was said by the senior doctor on the study team.
Dr. Katrin Andreasen, yes.
Yes. In this study, they identified the EP2 receptor. Oh, we're getting deep into the chemistry again. So hormones are chemical messengers that go from one part of the body to another part of the body where they tickle a receptor on some cell and makes that cell do something. And so every hormone has its own kind of receptor. And so prostaglandin E2 hormone has EP2 receptors to dock with on cells.
Yeah, that was paraphrasing what Dr. Andreasen, the professor of neurology at Stanford University, said in her report, which was a very detailed, very, very, in-depth, very difficult to read report. One had to have a lot of background in all of these studies that we've been doing to become physicians. And so for the average person listening, we're not going to bore you with all those details. But, 30 years ago, I prescribed a pain med called a COX-2 inhibitor. However, due to the side effects it created, I stopped prescribing it. These kinds of medications that interfere with the normal processing of the body chemistry should not be used if there is any other method of treatment available. I've learned so very much about how to help the body function without all those pain meds since then. Now they're only used for a few days as the problem is being corrected.
Yes, many thousands of people died from the side effects of Vioxx, a popular COX-2 inhibitor, before the FDA figured out what was happening and removed it from the market.
I think that's what I was prescribing.
Yes, most likely. There are several others, one of which still is on the market but has a black box warning on it. But the main point is that COX-2 is an enzyme that's in the same biochemical pathway that makes prostaglandin E2. I'm concerned that blocking prostaglandin E2 receptors may have unintended consequences, just like the COX-2 inhibitor did. From a naturopathic point of view, it's better to naturally balance prostaglandin E2 levels by increasing food intake of omega-3 fatty acids found in fish than it is to block, and a more honest word is poison, a biochemical pathway that God designed. Immune cells are responsible for kicking off the inflammaging process, but the precise mechanism has not been confirmed. After much research, Stanford neuroscientists believe they've finally found the answer.
Well, getting back to our paper, Dr. Andreasen found the problem to be malfunctioning immune cells called myeloid cells. And myeloid cells include red blood cells, platelets, mast cells, basophils, neutrophils, eosinophils, monocytes, and macrophages. These are all types of immune cells seen in the common laboratory test called complete blood count, or CBC.
Scientists have long known that cognitive decline as we get older and specific age-related diseases, including Alzheimer's, are linked to inflammation, but they are still uncovering precisely why and how this is the case.
I want to reemphasize that. Alzheimer's, cognitive decline. That's specifically related to inflammation. Stop the inflammation. Get the test done, the IgG test done. Stop eating all those foods that you get positive results on. What a difference it makes when your body finally gets all of that chemistry out of it and the cells have a chance to work the way they were designed to work without fighting the thief in the night coming in the food that you eat, stealing your energy, taking all of your life force away from you. You know, many years ago, I mentioned this on the show a couple of times, I was in my mid-20s, and I went to a pizza parlor in Phoenix called Red Devil. It's not there anymore, I don't think. And they had a takeout window, and I'd ordered some pizza by phone. I went over to pick it up. After I picked it up at the takeout window, started walking 30 feet back to my car, my legs got heavier and heavier and heavier as I was walking toward my car. I had no idea why that was happening because I hadn't yet been fully educated in all of this that we're telling you about now. Now that you have the education, you need to start paying attention to the details. Stop eating those foods. Get the IgG test done. Get the S3 test done to find out how you're handling these things. So, gosh, you know, I keep sounding like a broken record, don't I? But it's so effective, so necessary for people. Heavens. Alzheimer's is linked to inflammation. And that inflammation comes in with the food you eat and the lack of proper blood flow because of twisting in the spine. So, Dr. Weyrich.
Well, Dr. Andreassen's research findings were published January of this year in the journal Nature, and they pointed out the role of the messenger hormone PGE2 found in much higher levels in older people and older mice than in their younger counterparts.
So when this hormone was blocked in older mice, they were able to perform as well as the more youthful rodents in tests of their memory and navigation?
Yes, the researchers found that higher levels of the hormone affected the metabolism of immune cells called macrophages, prompting them to store energy rather than consume it. That ends up effectively starving the cells and sending them into a damaging inflammatory hyperdrive. And we've already talked about how these cells become irascible and how this contributes to age-related cognitive decline and other diseases. So, this hormone, prostaglandin E2, is a major regulator of all types of inflammation, both good and bad. And yes, we do need inflammation when the time is right.
So this is why when I prescribed this medication that blocked that, it had the bad effects as well as the good effects.
Yes. In preparing for the show today, I reviewed the metabolic pathways that lead up to making prostaglandin E2, and it listed about 6 different effects that prostaglandin E2 has, some of which are good, some of which can become a nuisance. But blocking the pathway at any point blocks both the good and the bad.
So Dr. Andreassen, the senior researcher in this study from Stanford University, had quite a bit to say. It sounded like she was a naturopath, didn't it? She's using body chemistry and following it the way that it should be used and followed.
She is a true physician, meaning someone who understands the physiology of the body.
Yes. So in the study that they did, they identified the EP2 receptor. Now, what is that? That's the receptor that does what, Dr. Weyrich?
It is the receptor that cells have that gets tickled by the PGE2. And in particular, one of the effects of tickling the PGE2 receptor is that it leads to energy depletion and maladaptive inflammation if it's being overstimulated at the wrong time. but there's a reason for it to exist, but sometimes it just doesn't work the way we'd like it to.
So, Dr. Weyrich, what happens when these immune cells malfunction?
Well, the immune cells we're talking about are a group of cells that are called myeloid cells that are special immune cells found in the brain and the blood system and the peripheral tissues. They not only help defend us against infection, but they also are garbage collectors and clear away debris. However, as our bodies age, these cells malfunction and are unable to carry out these tasks effectively. So, myeloid cells are the body's main source of hormone-like molecule prostaglandin E2 that promotes inflammation, among other things. One particular receptor is found in abundance on all of these myeloid cells, which is, you guessed it, EP2. When PGE2 docks with EP2, it triggers inflammation inside the cells.
So that gets pretty technical again, Dr. Weyrich.
Yes.
My goodness. I hope our listeners are still with us and they're really eating up all of this technical stuff, because it's very important for them to understand this. I know they just want the bottom line all the time, but if you have a little background, when you go to the grocery store or you go to the restaurant and you start looking at what's there to buy, you start saying, well, gee, I need to do what we in medicine call a differential diagnosis. What's this going to do for me? What's this frozen custard going to do for me? What's this fresh yogurt going to do for me? What did my IgG tests show? So, Dr. Weyrich, what did all the culturing of samples from both humans and mice reveal?
Well, the researchers wanted to confirm that when this happens in older people, does it happen more often? So they cultured macrophages and also microglia, which are basically macrophages that are found inside the brain, from people over age 65, and compared those cell cultures to cultures from people under age 35. And they did the same thing with old and young mice. So they're growing these immune cells in a petri dish, basically, so that they can do testing on those cells.
So they found out what was really going on. And what did they find out, Dr. Weyrich?
They discovered that in both mice and humans, not only is much more prostaglandin E2 produced in the older cells, but there were far higher numbers of EP2 receptors also on the cell's surfaces. And even more in the blood and the brains of elderly rodents, they found much higher levels of PGE2 than they did in the blood and brains of younger mice. So the lead scientist, Andreasen, described the higher numbers of both the hormone and its receptor as a double whammy, a positive feedback loop. That's another technical term that we could spend an hour on, but we'll move on. That ramps up the intracellular processes linked to inflammation in the macrophages.
Oh my God, Dr. Weyrich. Listen, everyone. Dr. Weyrich's going to answer the question that the research showed. Dr. Weyrich, how does inflammaging happen?
Well, this is a damaging process that begins with glucose or sugar. Much higher prostaglandin E2 to EP2 docking in the older cells stimulates those cells to divert glucose, the energy molecule, into storage instead of towards the production of energy. So in other words, it's forming fat. And it's this chronic state of energy depletion that prevents normal cellular function and stokes the fires of inflammation.
But what would happen when the Stanford team blocked the receptor so PGE2 can't attach to EP2 in older cells?
Well, just a bit of review, because I want all of our listeners to get it. In both mouse and human myeloid laboratory cell cultures, researchers found improved glucose metabolism as strong as in the young myeloid cells and a significant drop in inflammation. So block the receptors and you get younger immune cells. The big question now was whether this restoration of youthful metabolism could be replicated in mice and not just in a petri dish. And if so, how would this affect their memories?
Turning back the clock for mouse memories?
Review time now. Stanford researchers used a group of mice that were genetically modified from birth that did not have the EP2 receptor on the macrophages and microglia. Then they gave a drug to normal mice that only turns off the receptor in macrophages outside the brain, but it couldn't pass what's called the blood-brain barrier and get into the microglia in the brain. Then the startling result was that under both conditions, old mice given navigation tests and object recognition tests to assess learning and memory performed just as well as their young mice counterparts. And what's even more exciting, in the healthy elderly mice, age-related cognitive decline was reversed. This fascinating finding means that resetting myeloid cells can have profound effects inside the brain. Dr. Andreasen described the changes caused by the prostaglandin E2 to receptor binding as a powerful pathway that drives aging, but it can be downshifted. If you adjust the immune system, you can de-age the brain, the neuroscientist said.
So all the patients examined and treated by my family of physicians practicing naturopathic and chiropractic medicine for the last 99 years have shown great reduction of inflammation. Now, Dr. Andreasen's research team at Stanford University says lowering PGE2 with food has been proven to be highly effective. So we help most people that come to us with their health problems, whether physical, internal, or aging. We evaluate and treat newborns to centurions. The take-home message from this radio show: to reverse cognitive decline, or at the minimum slow it to a crawl, is to eat a diet containing plenty of inflammation-lowering compounds that are found particularly in colorful fruits and vegetables to fight inflammation. Omega-3 oils found in many fish, while avoiding inflammatory foods such as refined sugar or anything processed or fried. There's also a wide variety of supplements available to help lower inflammation that we're able to scientifically help you choose. Our S3 test reveals each of our patients' retained level of the carotenoid molecule in the fatty tissues of their hand. Carotenoid, what is that, Dr. Wyrick?
Carotenoids are precursors of vitamin A and other similar compounds, which is necessary for our immune system to function in a normal manner. Examples of where carotenoids can be found are orange or green vegetables.
Well, what about the purple ones?
Well, yes, some purple ones have carotenoids in them as well. But just because it's purple doesn't mean that it has carotenoids, because, as we've already talked about, there are other antioxidants called polyphenols, which includes resveratrol, which is found in grapes, red wine, and berries, and dark chocolate, my favorite source.
Well, all berries or blueberries and cranberries?
I would say that all berries have some, but blueberries and grapes, I think, are the highest.
Okay.
And we've talked about quercetin and fisetin already.
So that's quercetin's found in apples, raspberries, onions, red grapes, cherries, citrus fruits. Now, what's the difference between grapes and red grapes?
Well,
resveratrol is in grapes, and quercetin is in red grapes.
Well,
that's confusing to me.
Excuse me. Well, first of all, the word grapes can refer to anything from the pale green grapes called white grapes often to the dark, almost black colored grapes and everything in between. Those are all grapes. Generally speaking, the darker the color of the skin, the more resveratrol is in it. And quercetin is a different compound, and this is one of the things about foods and natural products in general. They are all complex mixtures of many different beneficial substances. And so it's entirely possible that a grape can have both quercetin and resveratrol.
So what is fisetin? That's I don't hear of that very often.
Well, it's another polyphenol. It's richly found in strawberries, and it has beneficial antioxidant properties as well.
So we have patients that come into us and have gait disorders. They shuffle, and in a short time, within just a few weeks to a month or two, they're not shuffling anymore. So what do you think is causing the shuffling in these Alzheimer's and non-Alzheimer's patients in relation to what we've been talking about?
Well, for one thing, shuffling is particularly linked with Parkinson's disease, which is another inflammatory condition in the brain, and poor blood flow to the cerebellum is sometimes involved. Low B vitamin status can lead to shuffling, and of course, in general, good blood flow to the brain improves shuffling.
The American Geriatric Society Journal published an article not too long ago on the subject that I've just talked about here. It was in 2005, in October. And in that article, which study was done to compare the prevalence and severity and type of gait and balance disorders in Alzheimer's disease, vascular dementia, Parkinson's disease with dementia, and dementia with Lewy bodies, Parkinson's disease without dementia, and age-matched controls. That's quite a process, wasn't it?
Yeah.
So there were 245 participants, age 65 and older, in secondary care clinics in geriatric psychology, neurology, and geriatrics, which is where this was done. And what they found was gait and balance disorders were more common with PDD. Dr. Weyrich, do you know what PDD is?
I suspect that it's a Parkinson's disease.
It is Parkinson's disease with dementia. And VAD.
Vascular
dementia. Exactly. And DLB.
That would be Lewy body, I believe.
It is. You are really right on it, aren't you? So we have those kinds of patients, and the risk of gait and balance disorder was found higher in the non-Alzheimer's dementia groups than in the Alzheimer's dementia group. That means that it was related more to a different type of brain disorder, brain cell disorder. So if the gait disorder was present in mild dementia, in the Cambridge Examination for Mental Disorders of the Elderly cognitive subsection score greater than 65, this was diagnostic of non-Alzheimer's dementia. And that has sensitivity of 70, all this technical stuff here. But the findings support the idea that gait and balance assessment may augment the diagnostic evaluation of this dementia. So what do we find all the time, Dr. Weyrich? That shuffling, that gait problem, how long does it last when we start giving treatments to patients?
Well, not too long.
Almost all the time, it starts to reverse once we get blood flow back into the brain and spinal cord, and they start eating a better diet, which doesn't have any of the inflammation-causing foods in it. So, another study done on the subject of dementia, geriatric cognitive disorders, August 10th, 2020, said the prevalence of autonomic symptoms in dementia and their association with physical activity and activities of daily living and quality of life. The bottom line is that higher autonomic nervous system scores. Now, what's the autonomic nervous system, Dr. Weyrich?
Well, it is more or less the automatic autopilot that controls basic body functions like heartbeat and respiration, and also prepares us to either digest our food or run away from a bear so that we don't become the bear's food.
And you've got two kinds of it, parasympathetic and sympathetic.
Yes.
So the parasympathetic comes out of the skull and the pelvis, and the sympathetic comes out of the neck and the thoracic spine all the way down to the lumbar spine. And the two are like two kids on a teeter-totter. They balance each other all the time if they're working properly. But if you don't have good blood flow everywhere, they can't work properly. So not only do you have to have good blood flow, but you have to eat right too. Isn't that interesting how it always comes back to the same thing? You got to take care of your diet, and you got to get rid of all those kinks in your spine.
Yeah, and you got to change the oil in your car and keep the radiator topped off.
And don't ignore the dash light.
Oh, well, can't we just take some wire cutters and fix that light for good?
If that warning light comes on, you want to pay attention to it, don't you? Otherwise, you're liable to get stranded somewhere. You know, these pains that we talk about, the malfunctioning we talk about, this is something you have to really work at, and you have to take care of it when it occurs. The burden of the autonomic symptoms, that's the automatic nervous system of the body, is high in non-Alzheimer's dementia. The identification of such symptoms is of importance because of the detrimental effect of these symptoms upon physical activity, depression, activities of daily living, and quality of life. And that's in that article that was published in the Dementia Geriatric Cognitive Disorders Journal. So the autonomic dysfunction in neurodegenerative dementias, published in Neurological Science, June 15th of 2011, starts talking about the syncope associated to orthostatic hypotension. That means you get a little bit dizzy when you get up from being laid down or sitting down to a standing position, and that relates to blood flow in the brain, which sometimes is related to your neck being twisted, sometimes related to your back being twisted, sometimes it's related to the adrenal glands being under too much stress and being wrung out like a sponge, or you've gotten far enough along that the brain cells themselves are screaming at you. Urinary incontinence and constipation are other common symptoms in demented patients, mainly in dementia with Lewy bodies and in Parkinson's disease dementia. Alzheimer's disease and frontotemporal lobar dementia show less autonomic dysfunction. It's interesting how these all come together, and you have to be able to discern or figure out what's actually going on. That's what we do with our diagnostic testing over at Payson Health and Wellness Center. You know, we give free consultations. If you want to know what's going on, you got to come over and let us talk to you. We are located at 810 East State Highway 260. That's right between the American Legion and the 260 Cafe and just east of Culver's. The phone number is 928-974-7409. And I promise we won't bore you with technical data when you come in, but we will take a look at you with a technical eye. So, Dr. Weyrich, you were most interested in the dementia associated with physical activity.
Yes, I was wondering exactly how they were measuring the higher autonomic symptom scores.
Well, you have to get into the full. You can't take the abstract for that, can you?
I understand, but I was just thinking that this is screaming out as an application for the biofeedback technologies that we have in our office called heart rate variability.
You know that technology that you're talking about right now, that's for the brain function. That's just like the S3 is for the carotenoid digestion. So they can get both those tests over at our office on that free consult, can't they?
They can. My computer is temporarily down, but I'll have that up and running again very shortly.
You know, the computers go up and down all the time.
Yes, they do.
So we're not too concerned about that at this time. The autonomic nervous system dysfunction is a basis for predictive model of risk of neurological disorders in subjects with prior history of traumatic brain injury. Boy, I saw a lot of people with traumatic brain injury. You know, whiplash injury, any sports injuries, all of these cause these traumatic brain injuries. And what's another word for traumatic brain injury, Dr. Weyrich?
A concussion.
It is. So all these little concussions that people get, and they don't think much about it. But they do mount up because they all have their effect.
Yes.
And in getting a concussion, quite often, what's really happening is your block got knocked off your neck.
Yes.
You got your head twisted, and your first couple of vertebrae are twisted, and it's interfering with blood flow to the spinal cord into the brain.
Yes, there's a form of dementia that is called Plutulistic Dementia. Dr. Gear, do you know what a pugilist is?
It's a fist fighter.
Yes, a boxer. And another group of people that is very susceptible to accumulated concussive trauma are football players. And it doesn't just have to be the professional football players. Even in high school, there's concern that there's long-term damage being done to these young players' brains.
You know, it happens a lot, and people don't even know it. But what we really need to do is to check their spines and check their necks as well as their backs and take care of it so that it's not catching anybody and causing them to have problems later on in life.
And by the way, the research articles that we're talking about here will be available on my website probably by tomorrow. If you go to the menu and choose Multimedia Archives, there will be at the top of that archive a link for today's show. And we will have links for all these technical articles for anybody that wants to check them out and see that we're not just blowing blue smoke here. We've got real science.
It is real science. You know, you can also go to KMOGcountry.com and you can go to the shows on the ribbon on the top and click on that, and then it'll come up and show you podcasts on the drop-down menu. You click on that, and then the podcast screen comes up, and all the podcasts are there, kind of in a vertical series, but you have to scroll through them. Every podcast got pictures, so you have to scroll through the pictures, and then you have to figure out how to click on that. And in order to listen to the podcast, you got to find the picture with the rectangle of red with a white arrow in it, and then you click on that white arrow, and you can listen to the podcast. Whether it's our show or any other show, that's the process that you do to get to it, and it's really good. So I listened to it, and the clarity of the sound was so good. I really appreciate the quality.
And again, my website is drweyrich.com, and the KMOG Country website is www.kmogcountry.com.
That's exactly correct.
And how do patients call us for an appointment for a free 15-minute consult?
Well, they got to call 928-974-0600, 7409. And those consults sometimes last longer than 15 minutes, but we try to keep them down. However, you bring in all your imaging, and I get all excited when I see the x-rays up on the big screen. We've got a 6-foot screen that we put the images on, and you get a chance to look and see all these details inside your structure that had imaging to it, whether it's a x-ray, a CT scan, or an MRI. We look at all of those.
And if you bring in your laboratory reports, blood tests, and so forth, I will get all excited about those.
You do, don't you? So a lot of people are really excited when they start to see what they look like inside on these big screens because you can see everything. You see all the details. And you start to look at it and say, well, how does this really affect me? What does this twist here mean? What part of the body does it go to? You have all these questions, and I really work hard to answer all those questions ahead of time. And then what do we do for it? Well, we have various treatments. The treatments are based on old-time osteopathic medicine. Yes, we're naturopathic physicians, we're chiropractic physicians, we're not osteopaths, but the treatment that we use is based on old-time osteopathic medicine. The medical school that I went to originally was, the curriculum was set up by an osteopath back in the 1930s, Dr. McManus. I use a lot of his technique, and I use all of the things, the training that I got, full medical training, even including minor surgery, drugs. We had all that. People are quite surprised that we had this in-depth education. But it was very good. My father, a chiropractic doctor and a naturopath. My aunt, a chiropractic doctor and naturopath. My aunt from 1922, my father from 1923. My father, when I first went into practice with him, and he saw me doing all these examinations that I was doing and evaluating and he looking at people, he said, "You're just a backdoor medical doctor." And I said, "No, Dad, I'm examining people to find out what's wrong with them so I know what to do for them." He was traumatized by the allopathic world when he was starting out into practice because they were very anti-chiropractic and anti-naturopathy because it wasn't the same fraternity that they were, so they didn't like it. You know how humans are.
It's more like a turf war.
Well, now it's definitely a turf war, but it's becoming more balanced because humans are getting more educated, and the more educated they get, the more they won't allow the bullying of one profession to another. So when we show that we have our educational qualifications, we're allowed to get in. You know, we just had a piece of legislation pass in the state this year that put naturopathic physicians equal to MDs and DOs in certain institutional settings that were paid for by government monies. So if here in Gila County we had a health department clinic, which we don't have, but if we did have, we naturopathic physicians would be side by side with the MDs and the DOs in rendering medical care. There's a bill in the legislature right now for chiropractic doctors to be approved by the Access Program, but it's sitting still in the House. It's been passed by the Senate with an overwhelming majority, but sitting in the House, it hasn't yet been assigned to a committee. It may die for lack of that. I don't know. That would be too bad because we could certainly help a lot of people with proper spinal care before they would need to have any drugs or any cutting surgery. So there's a lot to be looked at here in helping people get better. I want to thank all of you for joining us on our show today and reminding you that we have these websites you can go to, drbobgear.com, drwyrick.com, and then, of course, KMOGcountry.com. And you can hear the shows, you can bring your friends. We're really here to help you. We do appreciate if you want to participate in the show, for you call in and ask questions or bring to us comments. So we'll see you again next week. I think next week we're going to have another really good show for you. It's going to be on something that will be less technical, though, I believe. It'll be more on the street, man on the street type thing. Alrighty, well, thank you, Mike, for having us here today. We really enjoy bringing Doctor's Housecall to the people and implore all of you to do your best in making yourself as healthy as possible. We don't want to spend money on you in the intensive care units. See you next week.